take you folks through the next case.
Yes.
He is a 32-year-old gentleman, and this gentleman has complained of low back pain for last 5 years, along with right-sided radicular pain and now weakness. So he has severe radicular pain, he has tingling and numbness in the lateral aspect of leg, foot, and he has weakness in the foot on the right side. He now, over last 2 months, he has started developing some symptoms on the left side as well. And at times they are also severe.
Okay.
On examination, his right SLRT is positive to just about 30 degrees, left is positive to about 50 degrees. He has significant foot-toe weakness, mainly on the right side, but some weakness on the left side as well.
So he's got a foot drop?
He doesn't have a foot drop. He has basically power of 2 to 3 by 5.
Okay.
And in the toes, it is about, on the right, it is 3 by 5. On the left, it is 4 by 5.
Okay.
So ideally, this case is a case for surgery. However, just to buy time and severe pain, the decision has been undertaken for blocks as of now. So I'll draw your attention to the MRI. There is, so if you see here, there is L4-5 disc prolapse and
Yes.
L5-S1 disc prolapse as well. And on the left side, you have a little more more disc herniation as compared to the right, on especially at L5-S1. At L4-5, if I'll just take you to the axial views, you see a good amount of right-sided disc herniation, and there is an extruded and perhaps a sequestrated small fragment as well,
Yes.
which is compressing the exiting, at the foramen, so perhaps touching the traversing root as it is coming out. Also, there is a central disc at L5-S1 here.
Right.
So the plan today is, I'll demonstrate again the same right L4-5, the long approach, and for L5-S1, we'll just demonstrate a midline interlaminar epidural block. So, I mean, sort of you'll see the complete repertoire. Is that okay, Deepak?
Yes, yes, it's
Okay, fine. So we are preparing the patient. Here we would be using the same set of epidural needle and loss of resistance technique, as well as the long needle block that I had already shown you. I'll just scrub and come. Sorry.
So, Ashish, can you again tell your plan?
So my plan is to do a right far lateral transforaminal block.
Same as you did in the last
Yes,
case?
same at L4-5, and then do a epidural block midline interlaminar.
At L5 level?
At L5-S1, because there's sort of central, so
Okay.
there's no point going either side. We want the drug to flow throughout.
And for L5 level transforaminal, you're not doing because of the iliac crest coming in the way? Hello? Ashish? We have lost audio. Ravinder? अच्छा ठीक.
जनरल उधर से मिल जाएगा.